Welcome to the Equipping the Saints radio talk show with your host, Apostle Marcus Beckton. The Equipping the Saints talk show is an informational show with you in mind. So prepare your hearts and your minds to be empowered, encouraged, and equipped through today's broadcast, Equipping the Saints.
Well, hello and praise the Lord. Thank you for tuning in to this edition of the Equipping the Saints radio talk show. This is your host, Apostle Marcus Beckton, and we're so honored and pleased to have each and every one of you tune in with us on today's broadcast. I'm really excited. This is the fourth Thursday or the last Thursday of this month, and as all of you that have been tuning in are aware that during our fourth Thursday or the last Thursday broadcast or episode, we normally have a thing called A Better You, and the purpose of that is to strengthen you mentally and physically. And so today we're going to talk about something that many times we have a tendency to overlook, and that is our dental care. And we've learned that dental care and of course the care of our teeth is oftentimes the most overlooked part of our body. So today we've got the privilege and the honor of having a dentist with us today, and she's going to share with us the importance and explain a few things and the importance of taking care of our mouth and taking care of our teeth. And so my guest today is none other than Dr. Brandi R. Jackson. She is a native of North Carolina. She's presently residing in running her own practice in Charlotte, North Carolina. And she has a long list of degrees and license and trainings that she has been blessed to acquire in the area of dentistry. And she's specializing in pediatric dentistry. And so without any further ado, I'm really excited about it, what she's going to say unto us today, and hopefully that's going to help us and share some very important things with us. And so without any further ado, please welcome to the Equipping the Saints radio talk show, Dr. Brandi R. Jackson. Welcome, Dr. Brandi.
Thank you. Thank you so much for that warm welcome. Yes,
ma'am. It is certainly a privilege, as I forestated, to have you to be a part of the show today to share some insight and to enlighten us on the area or in the area of dental care. And because so many people, as we've forestated, that we oftentimes overlook or has one of the most overlooked parts of our bodies, and that is our mouth or our teeth, really the care of our teeth. And so today she's going to hopefully share some things that will enlighten us when it comes to that, and hopefully compel some people to really get out and to be more conscious on their day-to-day care as well as their often care as it pertains to visiting their dentist and getting their teeth cleaned and things of that nature. And so I wanted to share basically today, talk a little bit about the care of our teeth, and Dr. Brandi's going to give us, hopefully within that, a few health tips that will help us in the care of our teeth. And then we're going to kind of flip over and talk a little bit about this wonderful lady's many degrees and trainings that she have done, and talk about a little bit about her life if time permits us. But basically, Dr. Brandi, first question I want to ask is what is enamel and what causes it, basically? Because I hear people, dentists, talk about this oftentimes, even from commercials, about enamel and how that with process of time enamel wears off of our teeth, and it kind of explain that to us, what it is and what, how to prevent it from wearing off our teeth.
Okay. Enamel is the outermost layer of the teeth, pretty much the part of the tooth that we can see. There are 3 layers to a tooth. That's the enamel, the outermost part, the white part. The second layer is dentin, and then beyond that, that's where you have your nerve of the tooth. So enamel is normally the first part of the tooth that breaks down whenever a person develops a cavity. Mm-hmm. And the way that process happens is that the process is called tooth decay, what we commonly know as cavities. And, plaque is constantly developing on our teeth. That's just a natural process that goes on in the mouth for everyone, and it's constantly happening. And plaque contains bacteria that accumulates on the enamel, pretty much happening at all times. So when we're consuming, drinks, beverages, and food that, have a high sugar content, the bacteria that's contained in that plaque that's on the enamel, it produces what we call an acid attack on the enamel. And over time, the enamel of the tooth starts breaking down, and that's when you get a hole in the tooth, and that's what, we know as a cavity. Other things that can affect the enamel of the tooth and cause it to wear down is consuming beverages that are really high in acid, and frequently, consuming lemons and things of that nature that really have a high acid content. Those types of things can contribute to the breakdown of the enamel. Another thing that I think people commonly overlook that affects the enamel of the tooth is our whitening toothpaste. One of the reasons that the whitening toothpaste are so effective is because that they're very abrasive and have a lot of grit, so to speak, in them. And with constant use of those whitening toothpaste, that abrasiveness of the paste can cause the enamel of the teeth to wear down, and ultimately that can result in sensitivity of the teeth as that enamel wears down.
Wow. So we have to be careful, if I'm hearing this correct, we have to be careful with the toothpastes that are labeled or are considered to actually help whiten our teeth, that could actually be not a good thing for our teeth?
Absolutely, because as those particular types of toothpaste are whitening the teeth, what they're actually doing is they're removing stain from that outermost level of enamel at a micro level. It's removing the stain on the teeth, but as a consequence, some of that enamel is also being removed at a very, 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 small micro level, but with continued use over time, that can really become a problem.
Okay. Wow. Now, you mentioned, and that's something that I was not aware of, because I'm just visualizing in my bathroom, because I think I have some teeth whitening toothpaste, and so. But just to back up for just a second, you mentioned about beverages that we drink, and I'm assuming most of those would be considered as far as your soft drinks that also play a major part in wearing down the enamel. But you mentioned lemon, consuming of lemon, and I know lemon juice is very potent and has very powerful. But now, and I assume that when you say lemon, that includes pretty much what, lemonade?
Well, when I say lemon, I'm not sure if you know anybody that likes to suck on lemons. We have some people out there that just like to suck on lemons, and due to that direct contact with the teeth, the pure lemon juice and its acidity level is very acidic. That contact and that habit over time causes what we call attrition, causing the enamel of the tooth to wear down. And if you look at the teeth of these people, you can really see a noticeable pattern of how the enamel has been worn down over time. You're not going to see that particular pattern of tooth wear with lemonade, because the lemonade is diluted, and it's not, the pure acid from the lemon, like when you consume the lemons.
Okay. Now, this processes, and help me, so I'm processing this in my mind. The enamel, as it wears away, it creates holes somewhat in the teeth, if I'm understanding this correct, which is what we call or is what is called tooth decay, or either cavities. Is that when cavities are created? Okay. Now, cavities, basically, how are cavities handled? Whenever you notice that a person has cavities, is there a certain way that you guys handle that as
right? Yeah, we have specific treatments that we can perform to get rid of the cavity and get the tooth back to a healthy place. And I think the most common treatment that our listeners would be familiar with is a filling.
Mm-hmm.
So a filling is one of your more basic treatments to treat tooth decay, and that's where we go in with what most people would call a dental drill and remove the decay from the tooth, and then we go back and fill that hole up and contour the shape of the tooth with various filling materials. So you may be familiar with amalgam fillings, which is what people commonly refer to as silver fillings. Or we may choose to use a material called composite, which is your white or your tooth color fillings. So that's our first, line of defense in treating a common cavity.
Okay.
When the cavity is larger and has already caused more destruction of the tooth, then the tooth may need to be capped. And the type of restoration that we place on that particular tooth when it is advanced is a crown. And a crown is basically when the cavity is too big and the tooth can no longer hold a filling, the tooth has to be completely capped or covered in order to protect that tooth long term. Okay. And there are different materials for caps or crowns that can be used. In the front of your mouth, we're going to use something more aesthetic like, porcelain or ceramic. And in the back of your mouth where, cosmetically it's not too much of a concern, other materials, other metals can be used, such as gold, or you may have a ceramic crown that has partially metal underneath it. For the back part of the mouth.
Okay. Now, where does root canals come into play? When is that a last resort, or when does that become?
Root canals are required when the cavity has reached a certain level of depth in the tooth. You know how we talked about the 3 layers: the enamel, the dentin, and then the nerve. So once the cavity has gone through the enamel, the dentin, and then reached the nerve of the tooth, that's when a root canal procedure is required. So basically, once the cavity reaches the nerve, now bacteria has been introduced into the nerve of the tooth. And once that bacteria infects the nerve or the root canal system of the tooth, now, you're susceptible to pain and infection and swelling. And, that can be a pretty serious life-threatening condition if not treated. So with the root canal, what we do is go in and remove the nerve of the tooth, clean out that whole root canal system and disinfect it, and then, fill it back up with the filling material. And at that point, the infection and the bacteria inside that tooth has been eliminated to get that tooth back to a healthy state. And I think it's important to mention that after a root canal procedure has been performed on a tooth, a lot of people don't understand the importance of having that tooth capped. It's very important to have that tooth crowned in a timely manner, or all of the work that's been done during that root canal procedure can fail. And that's just a waste of your time, your money, your resources if you don't have the tooth capped and then the tooth gets reinfected. Okay. So for everybody that's listening, that's a real vital point, that if you have a root canal done, you got to get that crown put on as soon as possible.
Okay, that's true. Quick question: do you find it when it comes to care, do you find it oftentimes that when people come, that their teeth have kind of gone on, or is it, well, maybe I should put it like this: can you tell when a person has cared for their teeth versus one that has not, whenever you begin to inspect them or go through, the process of checking them? Can you pretty much well just kind of look at it and say, okay, well, I know you've not been doing what you need to do, or is that kind of hard to tell?
Well, I think it's not too difficult to tell because, during the course of a routine cleaning and examination, if a person has a couple of cavities, then we can kind of assume, they've reasonably cared for their teeth. But for somebody that really has neglected their oral health over, the course of many years, those people are going to tend to have more needs. They're going to have, more cavities. The cavities are going to be at a more advanced stage where, they maybe need root canals or extractions. And, there can also be gum disease and bone loss. That's something we haven't touched on, but, that's another really big concern when it comes to your oral health is the health of your gum tissues and your bone. Because, without routine dental care, over time, bacteria causes the bone to resorb, and once it gets to a more advanced stage, you're at risk of losing those teeth.
Okay, I got you. And maybe we can have you back to talk about that gum disease, bone loss, and things of that nature, because sometimes people don't, they don't really know, and brushing, from what I've been told, is not enough to just to brush your teeth. Is that correct?
Right.
You've got to do
flossing. That's correct.
Okay.
Just a little bit of statistics. Almost 50% of adults in the United States have some form of gum disease. So that's 1 out of 2 people. Gum disease. The process has already started, and that's really high. So I think you raise a good point that just brushing isn't enough. You got to do that flossing. You got to do that flossing as a part of your routine care every day also.
Mm-hmm. That's true. That's very good information. Now, in a few moments, because I want to give you time to kind of talk about the things that you've experienced as far as getting into this field and some wisdom that you can share. But as I've forestated earlier, so you specialize in pediatric dental care. And so I know, for one, you got to have a bunch of patience. If you're working with children, I know, it's not always an easy task or whatever, but how can parents, and we hadn't originally talked about this question, but how can parents encourage their children to care for their teeth? Because sometimes it's almost like it might be even easier to pull teeth than it is for to get the children, some children to really care for their teeth and make that a priority, that once they get up and get, if they're getting ready for school or whatever and they're young, that is almost like a priority to them. How can parents, I guess, help encourage their children to do that?
Mm-hmm. I think it's very important for parents to make that brushing and flossing process a part of the child's everyday routine. Mm-hmm. So, whatever you do every day, methodically, whether, you get up and you have breakfast and you bathe, then you brush your teeth and floss, and you get dressed. It's very important for parents to instill that routine at an early age so the kids know that this is just as important as everything else that we do to keep our bodies healthy. Mm-hmm. And another thing, the parents, traditionally, the pediatricians have said that you don't need to take your child to the dentist until they turn 3 years old. Well, that's no longer the recommendation. The recommendation by the American Academy of Pediatrics and Pediatric Dentistry recommends that a child's first dental visit occur as soon as the first tooth comes in or by their first birthday. And that's just, that's a point that I want to reiterate and nail home, is that it's important to get babies to the dentist by that first birthday so that we can go ahead and start instilling these good habits at a very early age, and also educate the parents and help them, guide them on what they should be doing to keep the kids' teeth healthy.
Mm-hmm. That's very good. That is very good. And that's important because in years later, that basically help prolong the life of their teeth. Is that not correct? Starting at an early age and a person caring for their teeth. So yes, when they get of age. Go ahead. I'm sorry.
Yeah, if we can get those habits instilled at a very early age, then the child is less likely to experience dental problems such as decay, gum disease, the risk of losing the teeth, because they're going to carry those good habits into their adult life, and they're going to actually value, regular dental care just like they value any other type of medical care.
Okay, very good, very good. Now, that's and you've shared some very, very good, helpful information, and I'm very aware and often conscious of the fact that people, when people listen to that, sometimes there are people out there that have dreams and would always, even at a young age, you're a young lady, would sometimes have dreams of wanting to advance their life. And I know that being a dentist did not come easy. And I'm sure that it was, just looking at your resume, it was some years, I'm sure, to acquire what you have acquired in dental surgery, pediatrics, specializing in the trainings that you received or whatever. But share some wisdom in the few moments that we have left, whatever wisdom that you may have. We've got some young listeners that may be listening, and they may be toiling with pretty much, wanting to, whether it's not pursuing dentistry or even being a doctor, but just pursuing something that's going to benefit their life for the positive side. Because I'm sure that you're a role model. I've seen the flyer that you've got an event coming up that you're going to be speaking at. But just share a little wisdom with the listening audience on just some positive things, or whether it's relating to your life or the struggles that you went through.
Mm-hmm. Yeah, the path to becoming a dentist was a very long journey. I knew I wanted to be a dentist at a very early age as a young child. So there was never anything in life that I wanted to be other than a dentist. So I would encourage our younger listeners to identify your passion as soon as you can. Try to figure out, what really makes you tick and what you're passionate about, what you love, what your talents that you've been blessed with. Try to identify that as early as you can so that, you can write it down and make it plain, and then follow that through your matriculation through elementary school and junior high school and high school. And once you get to college, it's going to be a little bit easier to navigate how to get to where you want to be, because you've already, you've already fallen in love with what you want to do. And that's just going to make it a little bit easier. It's never going to be easy, but, knowing what you want to do and what you love and what you're passionate about helps it a little bit along the way.
Mm-hmm. Mm-hmm. Wow, that's important. Now, how was it for you? I'm sorry, did I cut you off? I'm sorry.
No, you're good.
Okay. How was it for you? I know oftentimes I hear people mention about having a good support system, having people around you to encourage you, and I know that's very important. With me being a pastor, and all the time I share with people, you always got to have people that's either where you're going, or either that they're trying to get there, that have, that people that are focused. So I'm assuming that having people around you is very important. But and I'm sure you've had that to be successful, because something that we did not talk about, that you play a vital part. I was just observing a video that you was a part of, and of doing some very positive things in the community, and really making an impact. And I think that's the big thing in life, is making a impact, that you're helping other people. And but how was it growing up to, from high school going into college, and you went to University of Carolina at Chapel Hill, and so how was that for you?
I think you raise a very good point about having. It's so vital to have a good support system at an early age. I was very blessed to have parents that really afforded me every opportunity to succeed. Mm-hmm. They really allowed me to just broaden my horizon and, no matter what new activity I wanted to try, whether it was acting or the violin or piano or soccer, they never denied me the opportunity to try new things. So I think for our parents out there, it's very important to just let your child develop and try new things that maybe you never had the opportunity to, and let them kind of figure things out along the way. And so, a support system is important. Try to surround yourself, when you're in high school and college, with positive people, like-minded people who want to be successful. And one other point that I think is the most important is having a mentor. Once you figure out what you want to do, you got to identify somebody else that's already doing it, and let that person serve as your guide along the way to impart wisdom and understanding and guidance, and just, a source of inspiration, somebody to look up to, so that when times do get hard, you have somebody on your team that's already been there and done that, and can tell you that, this too shall pass.
Very good. Very good. That is a wonderful thing, and I know without a doubt that someone is listening today, and that is an encouragement. I know the information today, and that is the ultimate goal that we have here on this show, to share information, because sometimes people just don't know, and as the Bible said, that my people perish for the lack of knowledge, and I often tell I tell our church and in many places that I go many times that you will suffer because you don't know, and I'm sure that even back on your career, that the things that you do as a dentist, that, people sitting there with a cavity or having to face a root canal or having to have caps put in, they may be thinking to themselves, well, I didn't know I should have been flossing, basically every day, or should have been flossing as often as I should, or brushing my teeth as often as I should. And a real quick note, something that we didn't cover, but I'll finish my point and then I'll come right back to that. But because of not knowing, they are now facing sometime with issues that if they had known, it would have prohibited or even delayed it. But the one thing that I want to add before we wrap off, when it comes to brushing your teeth, some I've heard say that, and I've heard some people say they only brush their teeth once a day, and that's in the morning. Then I've heard some say that they brush after every meal. Some say that they brush at least twice a day, morning and before they go to bed. Is there a certain rule of thumb on that, or suggestions on that, of how often one should brush their teeth?
The rule of thumb is that you want to brush your teeth at least twice a day.
Okay.
And that nighttime brushing before you go to bed is the most important, because anything that you've consumed throughout that day, the foods and the drinks and the sugary things, you want to make sure you get that off your teeth before you lay down, because once you go to sleep, it's just a natural process that your mouth is dry, and that sets up, that situation where the acid attack happens and the cavity process gets started. So at least twice a day, ideally after each meal, but definitely before bedtime. Okay.
Now, last question, and I didn't mean to flip back and flip back again, but things pop onto our mind. But are they a preference in when it relates to toothpaste? I know you mentioned about the that we kind of need to stay away from the ones that say that they whiten the teeth because it kind of creates some damage. But is there a certain type, as far as if there's a dentist association or whatever that suggests Crest or certain type of toothpaste, or is there something that we just need to stay with, just something that for cavities, or what is your suggestion on that?
In general, most of your fluoridated toothpaste are going to be pretty equal in their, ability to keep the teeth clean and to prevent cavities. But the most important piece there is that you want to make sure it does have fluoride in it, because fluoride is the ingredient in the toothpaste that's added specifically for the prevention of cavities. So, toothpaste for the most part is going to be a personal preference, but one with fluoride is specifically recommended. Another thing you want to look at, the brand that you're using and make sure it has the ADA seal of acceptance. ADA is the American Dental Association, and you want to make sure it has the ADA seal on it, because then you know that that particular toothpaste has passed a lot of rigorous testing to ensure that you're using a quality and a safe product.
Okay, I got you. Amen. That is very good. Well, Dr. Brandi, you have been a tremendous help, and I want to thank you for being a part of this show. And I know, as I first stated before, that I know that the information that you shared and have shared is going to help someone, to be encouraged as well as to do better with their teeth. And so I certainly do appreciate you taking out of your busy schedule to just to share with this our audience on today. And as I first stated earlier, we're going to have to get you back to talk about gum disease and things of that nature that many people really face, and how that there is help, and hopefully, as we share with that there is help for individuals. To our listening audience, we thank you so much for tuning in again to our talk show on today, and I certainly hope and I pray that something great has been said to be a blessing unto you, and I pray that the remaining of your evening will be blessed, and the rest of your week will be blessed as you're preparing to go into the weekend, and that you'll have a safe and happy weekend. And until the next broadcast, consider yourself have been equipped. Shalom.